On March 5th, I held a press conference informing Marylanders that we had confirmed the first 3 positive cases of coronavirus in Maryland. In order to mobilize all available state resources, I immediately declared a state of emergency. Since then, we have taken a series of bold, aggressive actions to successfully flatten the curve and avoid the nightmare scenario projected by public health experts. As of today, we have had 34,812 confirmed cases of COVID-19 in Maryland. A total of 6,404 have been hospitalized in our state, and tragically, 1,694 Marylanders have died from this disease. But together, our actions and sacrifices prevented hundreds of thousands of Marylanders from being infected and saved the lives of thousands of our friends, neighbors, and family members. This global pandemic has caused and is continuing to cause great hardship for so many people, not just here in our state, but all across America and around the globe. For the victims and the families of those who contracted this deadly virus, for the frontline healthcare workers, the doctors, nurses, and first responders, for the small business owners and their employees who are fighting for economic survival, and for the hundreds of thousands of Marylanders and tens of millions of Americans who suddenly lost their jobs through no fault of their own and are struggling to pay their bills or to put food on the table. This truly is one of the most daunting challenges that our state and our nation has ever faced. Unfortunately, the fight against this deadly disease is far from over. But because of the incredible courage you have shown and the extraordinary sacrifices you have made, Maryland and our nation can now at least begin to slowly recover. 3 weeks ago, we introduced our Maryland Strong Roadmap to Recovery, a safe, gradual, and effective plan which followed the guidelines issued by both the White House Reopening Plan for America and the National Governors Association's Guide to Recovery for States, and incorporated many of the principles of the American Enterprise Institute's Roadmap to Reopening and the Johns Hopkins Principles for a Phased Reopening. We also solicited input from our team of scientists, public health, and business experts, and our multi-agency state government coronavirus team to create this well-thought-out recovery plan for Maryland. The plan contained 4 essential building blocks which needed to be in place before we could begin stage 1 of our recovery efforts: expanded testing, increased hospital surge capacity and supply of PPE, and a robust contact tracing operation. We made it clear 3 weeks ago that if Marylanders continued staying home and continued practicing physical distancing, we were hopeful that the key metrics we were tracking, the rate of hospitalizations and the number of patients in ICU, would begin to plateau or decline in early May. 2 weeks ago, we declared that we were no longer just playing defense, but going on offense, aggressively targeting and isolating outbreaks and clusters, focusing our attention and resources on the hotspot areas with the highest concentrations of cases, while increasing mitigation efforts on the remaining areas of the state. Last week, with our 4 building blocks in place, and after a solid week of encouraging numbers, including a slight but significant decrease in hospitalizations and a consistent plateauing of our ICU numbers, our coronavirus recovery team unanimously recommended revised guidelines which allowed for elective medical procedures to resume at the discretion of local hospitals and healthcare providers, and the broadening of the list of safe outdoor activities. We also gave local governments the flexibility to take certain actions at their discretion. We have been continuing to closely follow the key metrics over the past week, and today I am pleased to announce that Maryland has achieved the 14-day trend of plateauing and declining numbers. The number of coronavirus hospitalizations is down from 2 weeks ago. The number of COVID ICU patients has plateaued for a significant period of time and is trending down over the past 14 days. The rate of new deaths is also trending downward. This allows us to cautiously and safely begin Stage 1 of the recovery plan. Effective this Friday, May 15th at 5:00 p.m., we will be lifting the stay-at-home order, and we will be moving instead to a safer at-home public health advisory. Based on extensive input from our coronavirus recovery team and with guidance provided by the comprehensive reports from our 15 industry-specific advisory groups, we are also issuing guidelines for the safe reopening of the following beginning at 5:00 p.m. on Friday, May 15th. Retail stores in Maryland may reopen with up to 50% capacity and with strong social distancing, masking, and other safety precautions, and while continuing to strongly encourage curbside pickup and delivery. Manufacturing may resume operations in a safe manner which protects the health of their employees, with guidelines encouraging multiple shifts to limit the number of people working at the same time, limiting proximity of employees, and other safety precautions. Some personal services, including barbershops and hair salons, may reopen at up to 50% capacity by appointment only and with appropriate health and safety guidelines. Pet groomers, animal adoption shelters, car washes, art galleries, and some other activities will also be able to begin reopening. Churches and houses of worship may begin to safely hold religious services. Faith and worship are such an essential part of the lives of so many people. Holding services outside is strongly encouraged. Religious leaders are strongly urged to do everything possible to keep their congregants safe, and particularly to protect the elderly and the vulnerable within their congregations. Inside services may be permitted at 50% capacity or less, with appropriate distancing, masking, and safety protocols strongly advised. Reopening businesses are encouraged to take the Maryland Strong Back to Business pledge, which will help assure their customers and members of the public that they are adhering to best practices and strict safety guidelines in order to keep Marylanders safe. This Back to Business pledge can be printed and posted on your storefront by visiting open.maryland.gov/backtobusiness. Yesterday, I led another call with county executives and local officials from every jurisdiction in the state. I assured our county leaders that as we begin to slowly and cautiously lift restrictions at the state level, that we are providing for a flexible, community-based approach which empowers individual county leaders to make decisions regarding the timing of stage 1 reopenings in their individual jurisdictions. As our state cautiously moves forward, we fully understand that not all counties are in the same situation. Just 4 of Maryland's 24 jurisdictions currently account for more than 70% of our state's total confirmed cases. Prince George's and Montgomery counties have the highest number of cases, and they have made it clear that they are not yet ready to move into stage 1, while many other counties with a lower number of cases feel strongly that they are able to do so. I want to be very clear, while lifting the stay-at-home order and gradually moving into stage 1 of our recovery is a positive step forward, it does not mean that we are safe or that this crisis is over. Low risk does not mean no risk. All Marylanders, particularly those older and more vulnerable populations, are advised to continue staying home as much as possible. Employers should continue to encourage telework for their employees whenever possible. Individuals who can work from home should continue to do so. People should continue wearing masks in indoor public areas, retail stores, and on public transportation. We know that in general, outside activity is safer than inside activity, and that at all times and everywhere, Marylanders should continue practicing physical distancing and trying to stay 6 feet apart and to continue avoiding close gatherings of 10 people or more. Everyone should keep washing their hands often and frequently sanitizing high-touch areas. If these stage 1 activities resume successfully without a spike in hospitalizations, a sustained spike in ICU cases, or significant unforeseen outbreaks of widespread community transmission, then we will be in position to move to stage 2 of our plan. Unfortunately, the painful truth is that this virus will continue to be with us and to be a part of our daily lives. And potential outbreaks will continue to remain a deadly threat until a vaccine is widely available. And each and every one of us has an obligation to continue to exercise responsibility for ourselves, for our families, our coworkers, and our fellow Marylanders, so that as a community, together, we can begin to safely get back to work and get back to our daily lives. As we begin stage 1 of our recovery, I want to assure every Marylander who may feel uneasy and anyone who is concerned that we are moving either too quickly or too slowly, that each and every decision that we make is both fact-based and science-based and is made only after extensive consultation with our expert coronavirus recovery team. We are continually monitoring this crisis. We remain focused on the clusters, outbreaks, and hotspots, and I can assure you that we remain ready to quickly and decisively respond to any changes in the facts on the ground, that we will continue to attack this virus with every tool at our disposal. This crisis has tested all of us in nearly every way imaginable, but it has also revealed the true character of Marylanders. It has shown our ability to overcome any challenge and our capacity to show remarkable courage in the face of grave threats and overwhelming obstacles. Maryland has been and will remain at the forefront of fighting this pandemic. We're producing essential equipment for our frontline healthcare heroes, and we are driving innovations to treat this disease, to create a vaccine, and to save lives. And most of all, we're showing America and the world the power of compassion, generosity, and strength. We still have miles to go on this road, but we are all in it together. And if we stay strong, Maryland strong, we will get through this together. And with that, I'll be happy to take some questions. Brad?
Look, we've made this decision. There are those out there who have said it's not time yet, and there are no walls between the counties that are going to open and aren't going to open. How difficult was it for you to make this decision? How confident are you going forward that you're going to still be able to keep it under control?
Well, they are all very difficult decisions, and it's something we've been working on and thinking about for many, many weeks. It's part of our plan that we rolled out about 3 weeks ago. We've been constantly watching and looking at this and talking to all the experts, and again, in consultation with all of our local leaders and with our scientists and doctors and business leaders. And we're hopeful that the plan is the right one, but we're going to continue to watch and continue to monitor this on a daily basis. But we believe it's the right decision at this point in time, and from all the input we've gotten. Obviously, some people think we're moving too fast, and some think we're moving too slow. So it's probably about the right move.
Governor, you mentioned that there are a couple of jurisdictions that have decided not to reopen. Are there any concerns about people from those jurisdictions flooding some of the areas that will reopen?
I think there are concerns about that. Yes.
Governor, did Dr. Inglesby and the other experts sign off on this?
Yes.
A couple of weeks ago, you said that you want to see declining numbers everywhere. And what we've seen really, there are slight declines, but it's more of a plateau. Why did you decide this was enough of a decline to reopen?
Well, when I laid out the plan 3 weeks ago, I said we want to see a plateauing or leveling, flattening of the numbers, and we look for a decline. We have a plateauing, leveling, flattening, and a decline of the numbers. So it's exactly what we were hoping for.
Lifting the stay-at-home order, does that mean the out-of-state travel ban is no longer mandatory and the 14-day quarantine that goes along with that, or went along with that?
Yeah, they were both just recommendations. There never was an order regarding either any kind of a mandatory quarantine. We were just advising people that were traveling from out of town that they should consider quarantining, so that it was never part of an order. We're still asking people to exercise caution and good judgment, but it wasn't part of any stay-at-home order.
Governor, the Baltimore Field Hospital has 16 patients. Any plans to close that or adjust that at any point, as far as Laurel might be concerned as well, given the numbers today? A lot of business owners, too, that I talk to say, we don't get to phase 2, I can't hang in there much longer. What advice do you have to those folks who are doing their best to stay open and stay relevant during this pandemic?
On the first question, our goal was not to fill up the surge hospitals. It was to have them on hand and to not fill them up. The whole idea was to stop the 300,000 infections and the 12,000 deaths that were predicted, and that's what we've been successfully doing. But we had to have the surge capacity in case we did and or do get those spikes. I'm very happy that those surge hospitals are not overflowing with patients that are sick right now. But I'm really happy that we have them on hand in case we do need them. With respect to the businesses, look, I'm a lifelong small business owner who ran for office because I wanted to grow small businesses and put people to work and grow our economy. This is the worst economy since the Great Depression. I feel for those business owners that I understand they want to get reopened, and I understand people need to get back to work. But we are going about this in what we believe to be a safe way. We're trying to take into consideration both the economic and the health considerations at the same time, and we did it in conjunction with, as I mentioned, all of those, the best advice from all of the plans, in conjunction with our 15 business work groups, with our business leaders and our scientists, and we're trying to move at the right pace. We believe I'm anxious to move into phase 2 and get the rest of the business open, but a lot of it depends on how everyone treats this first phase. If everybody goes crazy and does things that are unsafe, we're going to balloon back up and slow down the process. If everybody responds responsibly, we'll be able to move forward, quicker. Luke?
With the expanded opening of businesses, will the child care services be expanded to accommodate workers from those previously considered non-essential staff?
Yeah, it's one of the big things that we're grappling with and trying to deal with, because as more people go back into, we have a capacity now with the essential worker daycare that are open and run by the school system, and we're broadening that to include more people that are going back to work. But Dr. Karen Salmon is working on a reopening plan, which I think we'll have early next week, to get safely reopen additional daycares for those folks that are going back to work.
Governor, Maryland has one of the highest test positivity rates in the nation, third highest in the nation. Public health experts say that can't be fully explained by the fact that the state is doing more testing. Is there a concern about the fact that Maryland has got a 25-26% positivity rate as we're heading into this reopening?
Yeah, well, so part of that is because we flattened the curve and we took early and aggressive action. So we're hitting a little bit later in the process than other places that have already ballooned up, like around the country. Is because of actions that we took, but part of it is because of our population centers in the Baltimore-Washington corridor. As I said, 70% of our infection rates are in 4 counties. I think 50% of it is in the 2 counties surrounding Washington. And Washington, Prince George's, and Montgomery County in Northern Virginia right now are the hot spots in the country behind New York.
Speaking of those areas, can you tell us how much talks with Virginia officials and District of Columbia officials played any role in what you're announcing here today, and how things look on that going forward?
We've had great ongoing, continuing discussions and great collaboration with both the district and Virginia. We just had a discussion, I believe it was Friday, with Governor Northam and Mayor Bowser. And we're more in sync, I guess, with where Virginia is than where D.C. is, because we're more alike, right? We have urban and suburban and rural areas, whereas the district is simply an urban area. The district's issues look more like Northern Virginia and our Washington suburbs, and that's not the same as the Eastern Shore, Western Maryland, Southern Virginia, the Eastern Shore of Virginia. But we certainly got good input from both of them and took into consideration what was going on in both the district and in Virginia. And I think we're all in accord on what's going on. We're working together on regional issues.
Governor, on the same subject, Prince George's, Montgomery County, Angela Alson-Brooks is going to have a press conference tomorrow, I assume, to lay out more of her plans. Will you be monitoring the numbers in those counties and at some point say, hey, your numbers have improved enough, we've got to move it along, or do they have total latitude? I mean, how are you handling that aspect?
Well, we're going to do everything we can to continue to assist County Executive Alson-Brooks in Prince George's County. They do have a serious problem. They do have our highest infection rate and our highest number of cases. And it's why we focus so much of our attention. It's why we're on our hospital surge capacity, on where we're putting PPE, where we're trying to focus more testing. And we understand exactly the issues she's dealing with. We're trying to provide the support. We're in constant communication. We had a great conversation. We'll work collaboratively with her. We do not want them to do anything that they feel is unsafe for their county. And I think we'll jointly be following the progress there. And we want them to get their numbers down. We want collectively to say, hey, we've made great progress here and Prince George's County is ready to open, but we don't want them to do it when they don't feel they're safe.
Anthony Brown put out a statement throughout the press conference saying
more PPE for kids, should be in both in Prince George's County. Can you give an update sir, on how things are going? I don't know if you have to say what.
Sure. We talked about that in our county call yesterday with all the county leaders. I think Anthony Brown is confused about I don't think he understands the difference between swabs and test extraction kits and test kits. So a lot of people are confused about this, but there's 9 different components that go into this testing. The thing that we have a huge supply of test kits. Those, we have 500,000 of them. They never ever go out to the counties. They never will. Those go to the labs. That's what the scientists use to do the actual, when they finalize the testing. They don't go out to anywhere. What goes out to the counties are the swabs and the extraction tubes. It's where they stick the thing in your nose, they put it inside of a plastic tube with an agent, and they send those off to the lab, who then takes that test kit and does the study, gets the result, and sends it back. So we've been great and are better than almost anybody in the country on test kits. As I said when I made the announcement, we were able to get 500,000 test kits, but as I announced then, we were very short, as was everybody in the country, on swabs, reagents, and lab capacity. On the lab capacity, we invested in the University of Maryland. We're ahead of schedule on a new lab that will be able to process 20,000 tests a day. We went from 50 tests a day to 8,000 some now. Our initial goal was 10,000, which we should be very shortly. So we're up to speed on that. We just yesterday got our first swabs and the extraction kits from FEMA, which we've been asking for months. We told the counties, including Prince George's County, we're going to get those out to them very shortly, everybody, so they can start to do more of that testing. But Anthony Brown was talking about why haven't we sent these test kits that actually go to labs out to the counties. That's never going to happen. It was never part of the plan.
Last question, of the 100,000 swabs you requested from FEMA, how many came in the first shipment?
We requested 350,000. They've committed to 225,000, and I think we got 75,000 yesterday, with another 125,000 that are supposedly days away, along with the tubes and the stuff that goes with them. So it's not enough, but it helps us. But on we've been able. I think what we've been doing so far is all of the nursing homes, the Salisbury, all the hot spots is where we've been using them, but the counties, we're short of those things. There was no swabs really in America. There was one place in the world that made them. It was in Italy. The president used the Defense Production Act to force companies in America to produce swabs. They finally have. And FEMA is slowly getting them out to us finally. But I announced that was the big thing we were missing.
Thank you.
All right, thank you.